I'm Bill Nelson, Director of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, and welcome all of you to the 12th Annual Survivorship Program, this year entitled Living with Cancer, Self-Care and Survivorship. We have three wonderful guest speakers this year, Monica Bryant, Samantha Schrager, and Elizabeth Soucy. They're going to walk us through the ever-changing landscape associated with health insurance, the value of peer support and where to find it, and about eating well and thriving. Thank you so much for joining us. Grab some lunch and get ready for a wonderful webinar event.
Good afternoon. My name is Tambra Chisholm, a member of the Harry J. Duffy Patient and Family Services Program. As a clinical oncology social worker, I serve Green Spring Station at the Medical and Radiation Oncology Clinics, providing day-to-day coping, practical assistance, guidance with money and legal matters, and managing care. I join Dr. Nelson in welcoming you to our 12th annual Cancer Survivorship webinar, featuring three speakers on pertinent topics relating to self-care in survivorship: care of self, care of others, and care for your financial future. This program is offered to you through the generosity of the Harry J. Duffy family, which we thank them. Allow me to share some details about this virtual presentation. Speakers have no relevant financial relationships to disclose. Participation in this webinar is voluntary, and the content and opinions expressed are those of the presenters. Attendees are encouraged to consult medical or health practitioners as appropriate when applying this information. You may offer a question or comment through the question and answer button during and after the presentations. We have allotted time at the end of all presentations for a speaker panel, and our moderator will raise your questions at that time. Given the attendance, we may not be able to specifically answer each question, but please feel free to reach out after the webinar. I will now turn it over to my colleague, Rhonda Cooper.
Thank you, Tambra. It is my pleasure to welcome our first speaker, Samantha Schrager. She serves as the Director of Partnerships and Impact Initiatives at Cancer Hope Network. In this role, she works closely with hospitals, corporations, and community organizations to expand Cancer Hope Network's peer mentorship programs, which provide crucial support to patients and caregivers throughout their cancer journeys. With a focus on fostering partnerships that create meaningful impact, Samantha is dedicated to ensuring that hope and guidance are accessible to those who need it most. I now am so happy to welcome my friend, Samantha Schrager.
Thank you so much, Rhonda. Let me share my screen. Wonderful. Well, hello, everyone. As Rhonda said, my name is Samantha Schrager. I'm the Director of Partnerships and Impact Initiatives here at Cancer Hope Network. It's a pleasure to be here with you today and to share how peer-to-peer support impacts cancer survivors and their caregivers. Today, we'll explore the various ways peer mentors can assist individuals in their cancer journey, offering invaluable insights and support. We will also discuss how anyone can access our free support services through our exciting new partnership with Johns Hopkins and the MAPS program. This initiative reflects our commitment to ensuring that no one faces cancer alone and that every patient and caregiver has the resources they need to thrive. Let's start with a simple yet powerful truth. No one understands the journey of cancer like someone who's been through it. Whether you're the patient or the caregiver, navigating a cancer experience can feel isolating. While medical support is vital, there are times when you need more. You need someone who truly understands, someone who has faced similar struggles, walked in your shoes, and emerged on the other side. Peer support steps in at this exact moment. It's about connection. It's about finding someone who gets it. Someone you can talk to about the emotional and physical challenges that come with cancer. Sure, it's valuable and important to hear words of encouragement from doctors or family members, but it's different when those words come from someone who has lived it, That's where the magic of peer support lies. It creates a safe, understanding space where patients and caregivers can talk openly without the fear of being misunderstood. And that's exactly why Cancer Hope Network is here. Over 40 years ago, in the early 1980s, an oncology nurse working out of a New Jersey hospital began noticing a pattern. Time and time again, her patients would approach her, not with questions about their medication or treatment plan, but with the request that was much more personal. They wanted to talk to someone else who had gone through the same thing. They wanted to know if she could connect them with someone who had faced the same side effects, the same fears, the same unknowns of a cancer diagnosis. They believed that if they could just talk to someone with firsthand experience, they would feel less afraid, less alone in their journey. Through these conversations, she identified a significant gap in cancer care. While her patients had access to medical treatment, they were missing something essential: human connection, the kind of connection that only comes from shared experience. She realized that by pairing patients with survivors who had faced similar challenges, she could provide something beyond the medical care they were already receiving: hope. Inspired by Dr. Albert Bandura's self-efficacy theory, specifically the concept of vicarious experiences and peer modeling, she believed that peer mentorship could make a difference. She understood that when patients or caregivers connect with someone who has gone through the same experiences, their confidence, their sense of hope, their self-efficacy could be strengthened. And this, in turn, could lead to better outcomes. Patients more likely to begin and complete different treatments, caregivers feeling more resilient in their roles. With the support of her community, the Junior League, medical professionals, social workers, cancer survivors, and volunteers, Diane Paul founded Cancer Hope Network, originally called Chemo Care, in 1981. That first year, we supported 14 patients. Today, we've touched the lives of well over 50,000 patients and caregivers. Thanks to her vision and the dedication of so many, Cancer Hope Network continues to provide life-changing peer-to-peer support. In fact, we're proud to be the first organization in the nation to offer this kind of support to cancer patients and their loved ones, and honored to still be doing so 43 years later. We are incredibly excited to share details about our new partnership with Johns Hopkins. Earlier this year, we launched the MAPS program, Mentorship and Peer Support for Patients and Caregivers, in collaboration with Johns Hopkins Kimmel Cancer Center. This program is designed to provide personalized peer mentorship to cancer patients and caregivers at any point in their journey, whether newly diagnosed, in treatment, or navigating survivorship. The MAPS program is unique in that it recruits survivor and caregiver mentors from within the Johns Hopkins community, matching patients with mentors who not only share their diagnosis, but have direct experience with the Hopkins system. Whether someone is facing their first round of chemotherapy or managing life after remission, our mentors offer the kind of understanding that only comes from someone who's walked a similar path. They provide emotional support, practical advice, and reassurance, helping patients navigate complex decisions, treatment options, and the emotional toll of cancer. So by combining the expertise and resources of Johns Hopkins with Cancer Hope Network's decades of experience in peer-to-peer mentorship, the MAPS program provides a powerful support system for patients and caregivers. So whether you're just starting your journey, transitioning into survivorship, or considering becoming a mentor yourself, the MAPS program is here to help every step of the way, ensuring that no one has to face cancer alone. So what exactly does peer mentorship look like? What do our peer mentors do? As most of you in this room know personally, cancer impacts more than just your body. It affects your mind and spirit. The emotional toll of survivorship can include anxiety, fear of recurrence, depression, and a sense of losing control. These are tough feelings to navigate on your own. Peer support offers a lifeline. Research shows that talking with others who've experienced cancer can reduce feelings of anxiety and isolation. Peers can share coping strategies, offer emotional comfort, and validate feelings, helping survivors and caregivers process their emotions. Peer mentors are able to offer empathy, understanding, and shared experiences. This shared experience helps create a bond of trust and compassion between mentor and mentee. In addition to emotional support, peers can provide invaluable practical advice. For many survivors and caregivers, navigating the logistics of cancer treatment, appointments, side effects, managing home and work life can be overwhelming. Peers can share tips on managing the day-to-day aspects of cancer that medical professionals may not focus on, whether it's a survivor offering advice on how to deal with chemo fatigue, or a caregiver sharing how they've managed their own emotional health while supporting a loved one. This kind of practical wisdom can be transformative. And perhaps the most transformative aspect of peer support is the sense of empowerment it builds. When individuals hear the stories of others who have overcome similar challenges, they're inspired to advocate for their own needs. The strength of the community becomes a source of resilience, enabling people to take an active role in their healthcare, whether it's communicating more effectively with their healthcare team or making informed decisions about treatment. Peer support helps individuals trust their voice and advocate confidently for their own well-being. Mentors who've already navigated the healthcare system can offer valuable insights on everything from understanding medical terminology to accessing resources like financial assistance, support groups, or even complementary therapies. These shared tips can make a real difference, helping individuals feel more in control and better equipped to manage their care. Having someone who has been through it helps simplify medical jargon, treatment options, and access to resources, empowering survivors and caregivers to feel more confident in their healthcare conversations. Drawing from their own personal experiences, peer mentors can help their mentees formulate questions for their healthcare team and offer a supportive sounding board. Additionally, navigating the healthcare system can be overwhelming. Peer support networks provide that practical advice. Peer mentorship fosters empowerment and helping individuals feel more in control of their health journey during and after cancer treatment. I want to take a second and acknowledge the role the caregivers play in peer support. Caregivers play an essential yet often under-recognized role in the cancer journey, whether it's providing emotional support, helping to navigate those complex medical decisions, or managing the day-to-day needs. Caregivers face an enormous amount of pressure and stress. Peer support isn't just important for patients, it's crucial for caregivers as well. Caregivers often shoulder immense emotional and physical burdens. Through our caregiver-specific peer mentorship, we offer them not just practical support, but emotional validation, a lifeline to someone who truly understands the unique pressures they're facing. And recognizing the specific challenges that caregivers face, we even offer specialized training for our mentors who are caregivers themselves. This training focuses on understanding the unique emotional, physical, and mental challenges that caregivers face, helping to better equip our mentors to provide the kind of guidance and support that's tailored specifically to those needs. So by connecting caregivers with someone who's been through a similar experience, we're able to offer them a safe space to share their concerns, find comfort in shared experience, and gain practical advice for balancing their caregiving role with their own well-being. The impact of peer support is best understood through personal stories. I want to share one example with you. Feedback that came from a cancer patient who recently reached out for support through the MAPS program. After connecting with their mentor, they shared the following quote: "The promptness of your response to my online request for a mentor was amazing. It had a big impact. I felt like someone really cared. Thank you." Before connecting with their mentor, this individual rated their distress level at a 7 out of 10. After working with their mentor over several conversations, more than 6 interactions so far, they reported their distress had decreased to a 4. So not only did this patient feel heard and supported, but the connection helped them find emotional relief during a very stressful time. And in their own words, they felt like someone really cared. And this feedback isn't unique. Our post-match surveys consistently show that survivors and caregivers experience lower levels of distress and feel more empowered to navigate their cancer journey after connecting with a peer mentor. And it's moments like this that remind us of the profound impact peer support can have. We create meaningful connections for adults impacted by cancer with someone who understands and can help replace that fear with hope. Our program is always free and confidential for everyone. Patients and loved ones usually can find us online, are referred by a member of their oncology team. They may learn about us through their employee benefits at work, or referred to us by one of our partner organizations. Regardless of the path they take to find us, we're here to help. Anyone can complete our online match request form. Within one business day, our team will reach out to complete an intake call. This is an opportunity for us to understand what you're going through, learn about your diagnosis, your treatment, and your current circles of support. From then, our team will identify the best mentor match and have them reach out to you within 48 hours. We understand it's not easy to ask for help, so it's important to us that we connect you with the mentor as soon as possible. From that moment, the mentee controls their experience. You never know when that moment of crisis is going to hit. For some, it's at that moment of diagnosis. For others, it may come in the midst of treatment. And still others may find themselves caught up in such a whirlwind that that moment when they want to talk to someone doesn't come until after the gong is rung and the support system they've come to rely on looks and feels different because they're no longer in active treatment or seeing their oncology team on a regular basis. Whether they have a single question or looking to connect with someone on an ongoing basis, we are here. And while the majority of our interactions with the mentor take place over the phone, the way you communicate with your mentor is flexible and based on the type of support you're looking for. The needs of each person is different. The way they cope is different. And just like every cancer journey is different, so is every Cancer Hope Network match. Pairings between mentor and mentee are personalized based on the needs of each patient or caregiver coming to us for support. Many times someone wants to speak to someone on the same diagnosis, someone who's had the same staging. We were able to connect people on certain side effects or if they're experiencing a recurrence of their cancer. If someone's on maintenance therapies and wants to connect with a mentor who understands what that's like. Many people reach out to us as they're transitioning into that survivorship phase after treatment. We have a cohort of mentors who have participated in clinical trials, and they're available to connect with patients who are either participating or considering participating on a trial. We're also able to match on racial, cultural, and linguistic aspects of someone's life. We're able to provide such personalized matches thanks to the diverse network of survivors and caregiver mentors within our community. Their unique experiences and backgrounds allow us to connect patients and caregivers with mentors who truly understand their challenges. Our peer mentors reflect a wide range of cancer types, treatment journeys, and life experiences. After undergoing specialized training, they offer one-on-one support via phone, text, or email, providing patients and caregivers with a real connection from someone who has been in their shoes. Currently, we have more than 500 active mentors located across the country. They span ages 19 to 94, speak 15 languages collectively, including Spanish, Italian, Tagalog, and Arabic, and have collectively faced over 90 different types and subtypes of cancer. Every mentor is at least 1 year out from active treatment, is successfully managing maintenance therapies, or has served as a caregiver to the loved one with cancer. These mentors serve as a vital source of practical advice and emotional support, using their lived experiences and ongoing education to help guide others. By sharing their journeys, they empower those newly diagnosed to navigate their cancer experiences with confidence and hope. We know our mentors are still on their own journeys. They're just a bit further down the road. That's why Cancer Hope Network upholds a supportive philosophy. No one needs to help alone. Our mentors receive continuous training, resources, and support from our team of social work and healthcare professionals to ensure they feel equipped and supported in their roles. They can engage at a pace that works for them, fitting their role into their lives. There are several steps to becoming a Cancer Hope Network peer mentor. We want to ensure that each person who comes to us looking to give back is in a place in their own journey to do so. It begins with an application and a screening interview with our programs director. Once approved, you'll participate in a thorough training process, which includes a live training session and ongoing monthly roundtable discussions. We also place a strong emphasis on self-care and resilience to ensure you're ready to support others. We're excited about the future of the MAPS program and our growing partnership with Johns Hopkins. Our vision is to expand outreach, recruit more mentors from the Hopkins community, and ensure that every patient and caregiver who needs support can access it. Through this collaboration, we aim to empower more individuals to face the challenges of survivorship and caregiving with confidence and hope. The MAPS program uniquely integrates Johns Hopkins' extensive resources with Cancer Hope Network's peer mentorship expertise. We are actively recruiting mentors who have completed treatment at Hopkins, allowing us to pair newly diagnosed patients with someone who not only shares their diagnosis, but also understands the Hopkins experience. This extends to caregivers as well, ensuring that they can connect with someone who truly knows the complexities of supporting a loved one through cancer. If you're interested in becoming a mentor or referring someone for support, you can visit hopkins.org/maps. From there, you'll be directed to the Cancer Hope Network page, where a brief form will help us learn how to best assist you. It takes just 5 minutes, and a member of our team will reach out to help get you started. Together, we're building a supportive community where no one faces cancer alone. At Cancer Hope Network, we're proud to facilitate these powerful peer-to-peer connections, and we're not doing this alone. We're grateful to partner with healthcare providers and institutions like Johns Hopkins, where we integrate peer support directly into survivorship care. Together, we're ensuring that no survivor or caregiver has to face this journey feeling alone. Thank you all for your time, and I hope you leave today knowing that peer support is a crucial part of survivorship, and that support is always available, no matter where you are in your journey.
Thank you very much, Samantha, for a wonderful, insightful, and thoughtful presentation. Hello again. I'm Tambra Chisholm, and it is now my pleasure to introduce our next presenter, Monica Fawzy Bryant, Esquire, who is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on healthcare-related issues. She is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Throughout her career, Ms. Bryant has provided almost 1,000 seminars for people who have been diagnosed with cancer and their caregivers, as well as lawyers, advocates, healthcare professionals, elected officials, and others. Ms. Bryant is co-author of the first and only book on cancer rights law, published by the American Bar Association in 2018. She is also an adjunct law professor at the University of Illinois Chicago School of Law. I now introduce Ms. Bryant.
Thank you so much for that lovely introduction. I'm delighted to be here today. Oftentimes when I tell people I'm a cancer rights attorney, the response back or the question back is, well, what's legal about cancer? And to be perfectly honest, almost everything about cancer is legal. From what drugs someone has access to taking, to what health insurance have to cover, to what employment rights somebody might have to take time off, to replacing lost income, to estate planning, and everything in between. So our mission at Triage Cancer is to provide education about all of these different legal topics, and then also provide practical information about how to use the law to somebody's benefit. And we provide that education in a number of ways, including through educational events, materials. We have animated videos, we have print materials, we have a blog where we share late breaking news, and all of it is provided completely free of charge. So I'm going to spend some time today talking about health insurance, but if you have questions about other cancer-related legal issues that we don't touch on today, please know that in addition to all of the wonderful organizations you're going to hear about today, Triage Cancer can be a resource for you as well. One of the reasons that I wanted to make sure we talked about health insurance today is that most Americans don't understand health insurance. It is incredibly confusing, and if we don't understand the words or how health insurance works, we're never going to be able to effectively purchase the right health insurance for us. And the unfortunate reality is in this country, having the right health insurance not only guarantees access to the care that you might need, it also could have a direct impact on finances. I often say that there should be a class in high school on health insurance and finances because they're two topics that each and every one of us have to navigate, but we're rarely ever taught how to do so. So I want to start level setting and making sure that we're all on the same page with respect to the words that are used in health insurance. And the first is your monthly premium. And that's how much you're going to pay every single month just to have health insurance. And you're going to pay that whether you go to the doctor or not. But then there are some additional costs that you might incur when you actually use your healthcare. And the first is your annual deductible. That's a fixed dollar amount that you have to pay each year before your health insurance kicks in. Once you meet that deductible, your health insurance kicks in at a percentage, and that percentage is referred to as a co-insurance or a cost share. So just to make things even more complicated, we're going to have multiple words for exactly the same thing. So for example, someone might have an 80-20 plan. Once they've met their deductible, the insurance company kicks in at 80% and they're responsible for 20% of those healthcare costs. But many plans have an additional payment called a copayment, which is a fixed dollar amount that's going to depend on the policy, but it might also depend on the service you're getting. For example, it's really common to have a $20 copayment to see your primary care physician, but a $30 copayment to see a specialist, and a $250 copayment if you go to the emergency room. It is possible that on a single service, you could pay both a copayment and a co-insurance. But one of the most important things for each and every one of us to understand about our health insurance is the out-of-pocket maximum. The out-of-pocket maximum is a fixed dollar amount that represents the most you are going to pay out of pocket for your healthcare. And the way you get to that out-of-pocket maximum is by adding up everything you pay towards your deductible, everything you pay towards your copayments, and everything you pay for your co-insurance. And once you reach that out-of-pocket maximum, insurance will continue to cover your medical care at 100% for the rest of the year. So understanding the out-of-pocket maximum allows for us to plan around a worst-case scenario. It also allows for us to pick the right health insurance for us. So let me give you an example of how this all works. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80-20 co-insurance, and he has an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor yet this year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan actually have to pay of that $102,000 hospital bill? Well, the first thing we always have to pay is that deductible. So he pays his $2,000. It leaves $100,000 left in the bill because he's met his deductible. His co-insurance kicks in at 80%, and he's responsible for 20%, or $20,000. But thankfully, because Dan has a plan with an out-of-pocket maximum, he doesn't have to pay that full $20,000. Instead, he has to pay another $6,000 because he's already paid $2,000 in his deductible. So once he pays $6,000 of that bill, he's reached his $8,000 out-of-pocket maximum, and insurance will cover the rest of that bill at 100%. It will also cover any care he needs for the rest of the year at 100%. So I'm not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start looking at the alternatives without an out-of-pocket maximum, or certainly without health insurance, the $8,000 starts to feel a little bit more reasonable. Now, if you would like to hear any of that again, the terms or this example, or there's people in your life that might benefit from hearing those things, we have that included in one of our short animated videos on health insurance basics that's available in English and Spanish. With out-of-pocket maximums, there are some details that are helpful to understand. For example, if someone has a family plan, they might have an individual out-of-pocket maximum, but then also a family out-of-pocket maximum. So if there are multiple family members and 2 people have met their individual out-of-pocket maximums, the rest of the family gets all of their health care for the rest of the year for free. There are some differences depending on where someone gets their health insurance. So if someone gets their health insurance through a state marketplace, then that math problem is what I just explained, adding up everything you're paying for your deductible, your copayment, and your co-insurance for both medical care and prescription drugs. But if you get your insurance through an employer, employers are allowed to create their own math problem. So for example, some employers might carve out the deductible. So it's going to be your monthly premiums that you have to pay every month. It's going to be your annual deductible that you have to pay. And then they're just going to count your copayments or your co-insurance. And generally, plans are only going to include payments made towards in-network providers towards your out-of-pocket maximum. So if you get your plan through an employer, it is helpful to just double check what that math problem is for your employer. In this country, there are 3 places people get health insurance. About 50% of Americans get their insurance through an employer. A secondary place is through the government, primarily through Medicare and Medicaid. And then the smallest number of Americans go directly to a health insurance to purchase their health insurance. But regardless of where someone gets their insurance, those terms I just explained are going to be the same. Now, we have tons of resources on health insurance on our website, and you can go to triagecancer.org, resources by topic, and if you pick our health insurance hub, you'll see all of those different resources that are available for free in English and Spanish. I do want to walk through a simple exercise that we can all be doing when it comes to picking a plan. And it's particularly relevant right now because we are entering open enrollment season. We're currently in open enrollment for Medicare, and we are about to be in open enrollment for the marketplace plans. Many employers, although they can pick any time of year to have their open enrollment, pick a fall timeframe to coincide with a calendar year start date. And the reason this is so important is open enrollment is the time of year that each and every one of us can look at our health insurance options and make decisions for the year ahead. So if someone currently has a health insurance policy that maybe isn't covering a provider that they'd like to see, or they have high out-of-pocket expenses, this again is the time of year where we can make changes for the year ahead. So how do we do that? I'm going to give you an example using the marketplace, which is private health insurance that someone's purchasing. But the same analysis we're about to walk through works whether you're trying to compare a couple of marketplace plans or you're trying to compare options that your employer might provide if you have different options to choose from. You might also be using this analysis if you're trying to decide, do I take my employer plan? Or maybe do I go purchase insurance out on my own? It is also an analysis that you can use if you're trying to compare to Medicare Advantage plans. So here, I have 3 different plans. They each have a different monthly premium, a different annual deductible, and a different out-of-pocket maximum. If I'm trying to look at these plans and figure out which plan is going to cost me the least at the end of the year, can I do it just by looking at this screen? And the answer is no. You actually have to do the math. And the way that you do the math to figure out which plan is going to cost you the least is you take that monthly premium and you multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you add it to the out-of-pocket maximum. And when you do that for all 3 plans, we can see here that the Platinum plan at $400 a month ends up being significantly less expensive by the end of the year. Now, this exercise is assuming that someone is going to hit their out-of-pocket maximum, but generally speaking, when we're talking about cancer treatment, that's not a hard thing to do. It also allows us to plan for the unknowns. Think about Dan. He hadn't used any medical care yet in the year and then gets in an accident, and all of a sudden he has a huge bill. So some of this is about planning for the unknowns and seeing what it might be in a worst case scenario. But I will tell you from many, many years of experience, most Americans are only looking at the number in that first column. They're only looking at the monthly premium. And that only gives us a very small piece of the overarching puzzle. But of course, cost is not the only factor that we should look at. We also need to make sure before we pick a plan that all of the providers that we want to visit are in that plan's network. And so that doesn't just mean doctors, but hospitals, labs, imaging centers, pharmacies are all part of your providers and facilities. Additionally, each plan might have a different list of prescription drugs that it's going to cover and at what rate. And that list is called a formulary. So I say, after you've checked to see if your providers and facilities are in network, the next step is to make sure any drugs you are currently taking are on that plan's formulary. I also think it's helpful to have a conversation with providers about possibilities for next year. So many times in cancer treatment, there's a trajectory where, for example, you might be on a maintenance drug for X number of years after active treatment. Asking about what those potential drugs that you might be taking next year, you can also check to see if those are in the formulary as well for any plan that you're picking for next year. It's not a perfect system, but these are the steps that someone can take to best protect themselves and make sure that they're getting adequate coverage for them. We have a couple of resources that can be helpful in this open enrollment season, including an animated video on picking a plan that walks through that doing the math problem. We also have my very favorite resource at Triage Cancer, which is our worksheet on picking a health insurance plan. So this worksheet can be printed off of our website. Healthcare professionals can also order it in bulk hard copy. And what it does is it walks someone through gathering all of the information that they need to about each plan that they are considering, and then helps them figure out their math problem depending on how that plan's out-of-pocket maximum is calculated. So I think this worksheet is something that really anybody can use. It doesn't have to just be someone in the cancer community to make sure that whatever they pick for the coming year is adequate. The last thing I wanted to touch on today is some changes that you may have heard about in Medicare. For those of you that aren't familiar, Medicare is the governmental health insurance policy that covers individuals over the age of 65 or people younger than 65 who have been receiving Social Security disability insurance for 2 or more years. Individuals with end-stage renal disease or ALS are also covered by Medicare. Medicare is broken up into different parts, Part A through D, and each part covers something different in Medicare. The Part D is what covers prescription drugs. And prior to 2024, even when someone had Part D coverage, there was no out-of-pocket maximum. So if they were taking expensive prescription drugs, they still had to pay a percentage of that all year long. And of course, expensive drugs, even a percentage of that is expensive. And it was a significant financial hardship for many individuals. A law was passed in 2022 called the Inflation Reduction Act, and it did lots of different things, but for today's purposes, it made some really significant changes to Part D coverage, including adding an out-of-pocket maximum. And that the first year there was an out-of-pocket maximum was this year, but next year it gets even more, there's even more significant change. And so here's how coverage is going to look next year for Part D. First, the individual has to pay $590 in a deductible for their prescription drugs. Then they enter what's called the initial coverage phase. And during this time frame, they are going to pay 25% of their prescription drugs until they pay $2,000 out of pocket. Once they've paid $2,000 out of pocket, they hit their out-of-pocket maximum, and Medicare is going to cover 100% of their prescription drugs. So this is really significant that last year there was 0 out-of-pocket maximum in Part D. This year we do have an out-of-pocket maximum. Depending on whether someone's taking brand name or generic drugs, the dollar figure is different, but it could be up to $8,000. And starting next year, we have a $2,000 cap for everybody. So really significant changes that are coming down the pike for next year. The other piece of the puzzle is that in addition to this $2,000 maximum, there is going to be something called the Medicare Prescription Payment Plan. And this is exactly what it sounds like. It is a payment plan that individuals can enroll in that allows them to spread out that $2,000 across the year. So for someone that is taking a very expensive drug who might hit that $2,000 cap in January, that's a significant hardship for most people. And so they can spread out that $2,000 across the year. The reason I wanted to bring it up now is this payment plan is something that someone has to proactively enroll in with their Part D drug plan. So as you are looking at open enrollment right now into next year, if you are taking expensive prescription drugs, be on the lookout for information from your drug plan about how to enroll in this payment plan. I know that was a lot of information in a very short period of time, so I just want to remind you that Triage Cancer is here as a resource, and we do have a couple of events still coming up for the rest of the year, including our webinars. So next week, we will be talking about paying for prescription drugs, and then in November, we have 2 different webinars that might be of interest. We also record all of these webinars, so if you go on our website and see a past one that maybe you've missed, you can certainly watch the recording. We will also have our 2025 events up by the end of the year, so you can be on the lookout for that as well. At Triage Cancer, we know that we can create all of the resources in the world and host events every single day, and there's still going to be individual questions. So to try to address that need, we have our legal and financial navigation program. This is an opportunity for individuals who've been diagnosed with cancer, caregivers, or healthcare professionals and advocates to reach out to us and get answers to their questions on cancer-related legal issues. So the way that you would access the navigation program is by going to our website and filling out an intake form. Afterwards, you'll get an email with a link to schedule a call with us. On that call, we will probably gather some more information from you because oftentimes the answers to questions are going to be dependent on things like what state you live in and your household size. And then on that call, we're going to answer your questions. So we're going to explain your various options and potentially the pros and cons of those options. We might be able to give you your next steps that you need to take to try to address whatever issue you are facing. So again, I'm delighted to be here today and happy to answer any questions, but just know that Triage Cancer is here for a resource, as a resource for you. Thank you.
Thank you so much, Monica. What a timely presentation for this open enrollment season. Lots of helpful practical guidance, so we thank you. My name is Eve Carlson. I'm the Administrative Program Coordinator for Patient and Family Services, and we now welcome our last presenter, Elizabeth Soucy. She is a clinical dietitian at the Johns Hopkins Hospital. She covers inpatient and outpatient care in a diverse patient population. Her interest in oncology sparked during her dietetic internship at the National Institutes of Health in Bethesda. Since coming to Johns Hopkins, she's continued to learn from her interdisciplinary team and colleagues. Her alma mater, Penn State University, gave her a strong foundational knowledge in nutrition and dietetics, and she quickly said yes when invited to present today. We welcome you, Lizzie. Take it away.
Thank you so much, Eve, for the lovely introduction. Give me one moment. I'm going to share my screen with you all. Hopefully you can see that. Okay. So my name is Lizzie, like Eve said. I am a clinical dietitian here at Johns Hopkins. I work in the inpatient and outpatient setting, and I will be presenting on nutrition considerations in the oncology patient population, eating well and thriving. So the overview of my presentation today, I will start by going over metabolic changes in the setting of cancer. I will transition into some nutrition priorities to think about during treatment, whether it be radiation, chemotherapy, surgery. I'll dive into some nutrition impact symptoms and how to manage those that might be nutritionally relevant. And then finally, I'll wrap up with post-treatment nutrition and different nutrition recommendations for further guidance through your survivorship. So starting off with the metabolic changes of cancer and treatment, you may often hear that individuals with cancer have higher calorie and protein needs, or perhaps Your family member or friend may have experienced some weight loss upon their cancer diagnosis. So I wanted to take a moment to kind of dive into the metabolic changes that can occur during cancer diagnosis and cancer treatments. Um, it's a little sciencey, so bear with me. But there is an increase of pro-inflammatory cytokines that actually can be secreted during these moments and periods of time through cancer treatment. So these actually signal other molecules that can communicate to cells and ultimately alter their cell function. And kind of going down the cascaded events, it can lead to metabolic alterations, thus leading to cachexia and even weight loss. These pro-inflammatory cytokines can be the root cause of these nutrition-related issues that can come up later down the road. So expanding a little bit more and diving a little bit deeper into this inflammation topic, I spoke about before, this can lead to a breakdown of protein and fat stores in the body. For example, the protein stores can break down your muscle mass, or also can break down your fat stores in the form of subcutaneous fat or even adipose tissue. And this will be serving as fuel for your body to continue to work and keep yourself going through different types of treatments. You can also have increased blood sugar as well, just because your body is under a bit of stress, trying to continue to take on various forms of treatment. So overall, with this biological background, this presents the importance of nutrition and its significance in an individualized treatment course and meeting nutritional needs. So thus leading to higher calorie protein needs and maintaining weight throughout treatment. So now moving on to some nutrition priorities. There are many different nutrition recommendations and goals when working with oncology patients. The three main priorities that I like to think about, first is the completion of treatment and therapy, whether that be radiation, chemotherapy, surgery, or a culmination of some of all three. Keeping yourself nourished can then give you the strength to finalize these different types of therapies. And then the next two priorities kind of go hand in hand, meeting estimated nutrition needs to then maintain your weight, maintain your lean body mass, your muscle mass, and subcutaneous fat. So registered dietitians may often perform physical exams to examine different stores, whether it be fat stores in your face or also your muscle mass in your shoulders or clavicle bones too. This kind of gives us a better idea on how you're doing throughout your treatment course, just to make sure that we're intervening in a way that is proper and we're meeting your calorie and protein needs through different treatment. So these are some priorities that I like to think about, especially when assessing and working with various patients. So moving on to some nutrition impact symptoms. Nutrition is a vital part of your care. The better nourished you are, the better your tolerated treatment and the better that you overall feel. So oftentimes patients have difficulty meeting their nutritional needs prior to treatment starting or even during treatment. So a dietitian can set a plan in place to really start and rebuild nutritional health. And oftentimes it can be difficult to maintain nutrition because of various side effects. So I wanted to take a moment to dive into some of these symptoms that can happen with different chemos, radiation, and how to kind of nutritionally intervene to make it a little bit more tolerable to enjoy the foods that give you fuel and make you feel good. So I'll take you through a few. For example, dry mouth. This can often happen with head and neck cancer patients, perhaps going through a 6-week treatment phase. I like to help in meeting hydration needs, small sips of water throughout the day or Gatorade, ensuring that you're meeting your hydration needs. Oftentimes even people don't think about tart or sweet foods. Even sucking on lemon drops throughout the day can help to stimulate the salivary glands and help to kind of take away that dry mouth feeling. Frozen fruits and frozen fruit pops are also a great way to take away that symptom and help to even get in a little bit more nutrition throughout the day. So this is the first impact symptom. Moving on to difficulty chewing and swallowing. I also see this a lot with some of the radiation patients I work with in the outpatient setting, and shifting foods that may be crunchy or salty or, hard to really break down, moving to more softer foods like shakes and smoothies and soups, even cooking with moisture or additional condiments just to ensure that there is oral moisture in your cavity and as well as your esophagus too. And then adjusting textures as needed and incorporating small frequent meals or drinks throughout the day can also help. Moving on to taste changes, I see this quite a lot, especially with some chemotherapy deliveries. A loss of taste, or aguesia is the medical terminology of that, or even dysgeusia. Maybe there's a difference in the way food tastes. Maybe it used to taste sweet, but now it's almost salty or sour or bitter. Even oftentimes patients will say they have a metallic taste in their mouth. So these are some recommendations that I like to hone in on. For those with a loss of taste, you might see that adding additional flavor to food to really elevate that flavor of maybe your chicken dinner that you used to enjoy. You may have to add a little bit more seasoning to it just to pierce through that flavor a bit more. Also with the salty, bitter, and metallic taste, avoiding metal utensils, avoiding really iron red meats also can kind of take that flavor and effect away, thus impacting how much you're able to eat and enjoy during mealtime with family and friends. Next, looking at nausea and or vomiting. I know that Ensures Boost, a lot of those oral nutrition shakes tend to be a really great resource and tool to getting through nutrition treatment. So clear liquid beverages in the form of Ensures like Ensure Clear or Boost Soothe or Boost Breeze. Not sure if everyone is aware of those, but if you're experiencing any nausea or experiencing some vomiting, those are actually a little bit better tolerated than some milk-based oral nutrition shakes. So sometimes I'll recommend that to individuals. Choosing bland foods over fatty, greasy, or spicy foods too can help to get another meal down. Even opening your window and letting some fresh air through, so it's not just, your chicken dinner, your salmon dinner, that might upset your stomach and cause the nausea to worsen. Those alterations of environments can also help with consuming these meals as well. And even dry foods that are a bit more carby, like crackers, toast, or pretzels, might be a little bit more tolerated too. Cold, room temperature foods can also be a little bit less odorous as well, like I kind of mentioned before. And then this is the last symptom I wanted to go over. I see it a lot, poor appetite as well as fatigue. Increasing the amount of small frequent meals that you consume. A lot of people think, 3 golden meals throughout the day. Sometimes even decreasing them to a snack amount and scattering them out 4 to 6 smaller meals per day might help to increase the amount of nutrition you're able to get in when maybe your brain and gut reaction isn't quite working as well as it used to before treatment. Maybe your appetite is, fully gone away. You might need some more reminders of when to eat, whether it be an alarm on your phone or sticky notes around the house. Just little things to remind yourself to get in that meal or snack. Those calorie-containing beverages that I mentioned before too can be a really good tool, as it's a great meal replacement condensed with a lot of calories. Also eating well when you're feeling well. Some of the patients that I work with tend to have a really big appetite in the morning and maybe it decreases throughout the day, or vice versa. They're not feeling the best in the morning, maybe a little nauseous with no appetite, but further throughout the day, they're feeling a little bit better. So definitely maximizing on those times when you're feeling well, trying to eat a little bit more. And then having those easy and ready to eat foods on hand. This kind of goes hand in hand with the fatigue. Maybe having some hands-on snacks with, peanut butter crackers, or having an Ensure on the go in between treatment infusions or radiation. That can help to really just sneak in some more calories throughout the day. So then moving into some post-treatment nutrition tips. So early post-treatment, the dietitian can help develop an individualized nutrition plan for you that can help maintain weight, energy, and a healthy immune system as well. So with early post-treatment, weight recovery and ongoing maintenance of your nutritional status is one of the main points I like to focus on. So even recovering from symptoms and symptom management, some of those symptoms I stated before, maybe they don't 100% resolve as treatment ends. They might last a little bit longer. So continuing to work with those symptoms and continue to work with a dietitian one-on-one to see if we can find an individualized plan for you. And that kind of goes into my third point too. So some dietary recommendations after weight recovery and maintenance, symptom management, overall following a general healthy diet in survivorship and maybe off treatment nutrition is also a really good way to continue to live a healthy life. So these are just some broad recommendations of things that you can incorporate into your diet. So increase intake of fruits and vegetables, choosing whole grains, incorporating lean proteins like chicken and fish, avoiding trans fats or processed meats, and then limiting saturated fats and added sugars. These are all things to think about with a post-treatment diet mindset. I also wanted to touch on vitamin and mineral supplementation. So there's not really strong evidence for specific vitamins or minerals, botanicals. A lot of people might say, oh, I read about turmeric and herbal supplements that are vital in improving outcomes of cancer. So some concurrent use of supplements like herbals or botanicals can actually interact with chemotherapy, leading to an increase or a decrease of the effectiveness of either component. So sometimes I like to defer to providers first and pharmacists just to see if any of those herbal supplements will interfere with treatment or post-treatment as well. However, vitamin D and calcium can support bone health. And if serum levels are a little bit lower, these are really great ways to kind of supplement and normalize those levels in an individual's bloodstream. Multivitamins can be helpful as well for meeting baseline micronutrient needs with poor intake, poor appetite. But overall, my golden standard rule is if you're eating pretty well and you're eating a well-balanced diet with a lot of micronutrients, it's not really integral for you to add additional supplementation on top of it. I added in the dietary fact sheets from the NIH just because they do a really great job of adding vitamins, minerals, herbals, and the scientific proof behind different effects that it can have in your body. So I wanted to add this resource in here just in case if you're curious, you can definitely explore this page for more information as well. I wanted to add in Mary Eve Brown. She's one of my mentors. I think she's presented at this webinar in the past. She's a great resource as well. She works in the outpatient setting, and as part of the multidisciplinary care team, clinical dietitians can provide nutritional guidance. So I just wanted to give our emails in case you're interested or wanted to set up a visit or a consultation with us. And then I also added our general nutrition clinic's phone number if you're ever interested in meeting with an outpatient dietitian as well. I do have some works cited. A lot of these are great resources too to skim through. They're pretty accessible and easy to follow as well. And they also contributed to the majority of my slides with a lot of the data and science-y tips too. But thank you guys so much for allowing me to speak at this event. I look forward to discussing further in the Q&A portion of this webinar. Feel free to add any further questions that you might have for me. So I'll hand it on back to Eve.
Thank you. Thank you so much, Lizzie. That was fabulous. We now invite our other speakers, Samantha and Monica. They'll rejoin us for a Q&A panel. So again, there is a function at the bottom of your screen, a Q&A button. If you'd like to submit a typed question, we can either answer it live or we all have access to, all the speakers are able to type an answer as well. So I will highlight some that are coming in. Lizzie, question for you. How can a patient, looks like you were starting to type, but how can a patient address weight gain during immune therapy?
Yeah, that's a really great question. So weight gain could be a little bit multifactorial. So individuals going through immune therapy, if they're getting infusions too, it could be a little fluid related as well. It might not be true muscle or subcutaneous fat weight gain. That's why it's really important to meet with a dietitian because they can perform a physical assessment and see, okay, what's the root cause of this weight gain? Is it how you're eating? Is it maybe more medical related too? Are you having any fluid accumulation maybe in your extremities? So I kind of think of that as a whole picture mindset in terms of like a patient's status, if that makes sense. It's a little bit of a broad answer,
No,
so I
that's great.
apologize.
No, thank you. Perfect. I did also receive some questions upon when folks registered, so I'll tap into that bank while we're waiting for folks to submit some live questions. A question for Monica. Do you have any tips for planning for unplanned medical expenses? Any savings tips?
Well, I think some of that is about, I think I first, oh, there I am. I think some of that is about having the right health insurance. So what we talked about today in terms of picking the plan and looking at what the total annual cost would be for someone based on their out-of-pocket maximum is one way to make sure that you're planning for the unknown. Because then you can also start to work to save towards what that full annual dollar figure is going to be. I think also depending on the type of health insurance somebody has, there are some accounts that someone could access. So if someone has a high deductible health plan, for example, that can be paired with something called a health savings account, where someone can put money into that account pre-tax. And as long as they use that money for qualified healthcare expenses, they never pay taxes on it. So there's a savings there with tax. Some employers also offer something called a flexible spending account, which is a similar concept of putting money in pre-tax. There are some different rules with health savings accounts and flexible spendings accounts. So if someone is interested in learning more, we do have some resources on Triage Cancer that explain the differences and the pros and cons. So those would be my two main suggestions.
Great. Thank you. And one more, shooting over to you again, Monica. If a drug or a doctor isn't covered by your insurance, are the costs for that service included in the out-of-pocket maximum, or are they additive?
Typically, they're going to be additive. So usually health insurance plans will only count payments made towards in-network providers towards that out-of-pocket maximum. However, there are some plans that have a separate out-of-pocket maximum for out-of-network services. So that is a possibility as well. But usually it's only going to be in-network services.
Great. Thank you.
Sure.
All right. Again, encouraging everyone to submit your questions. I'll tap back into some that were asked by the registrants. For Lizzie, cancer-free, now what in terms of diet? Any maintenance strategies? Any triggers, concerns for causation for return? Any tips in that category?
Yeah, I think I sort of hit on this during my presentation, mostly following a general healthy diet. I kind of like to think about the My Plate method. It used to be the My Pyramid, making sure you're hitting all your food groups, making sure you're getting both macronutrients and vitamins and minerals in as well. There's a lot of different hot topic talks and variation in the research end if different types of foods play a role in remission. But it's a little unclear. So usually I'll kind of talk about just general healthy diet, or also weight recovery or weight maintenance. So maybe for a bit of time, we might have to follow a high calorie or high protein diet just to kind of rebuild and maximize nutritional status just after treatment. But yeah, that's kind of the rough overview there. That's a great question though.
Thank you. We have a question for Sam. Sam, do we have any mentors from the Sydney Kimmel Comprehensive Cancer Center ready to connect? Would they be a caregiver or a patient?
Yes, we do. Very exciting. We had our first training session for MAPS mentors a couple weeks ago, last week. And so we do have a cohort of mentors ready to go. It is a mix of patient and caregiver. Some really incredible experiences and very passionate mentors that are ready and standing by if anyone is interested in connecting with someone. And if you are interested in becoming a mentor yourself, wanting to talk to someone on my team, if you have questions, always please feel free to reach out, and we'll figure out how to get you involved.
Thank you, Sam. And
Okay.
I am going to put in the chat right now the link to the MAPS site where you can access this information and sign up.
Yes, and please feel free to share with anyone who you think may either be looking for support or looking to become a volunteer.
Thank you very much. All right. Seeing more come in. Let's see. Lizzie, what are the guidelines or thoughts on organic foods? Is that something that's advised better than not, or is there kind of a stance there?
Yeah, that's a great question. It's almost sort of a myth almost, or a fad, that you have to consume organic over just the regular typical brands at grocery stores. It's not necessarily indicated that you consume only organic. It's also a lot more expensive compared to other fruits and vegetables. You're still getting the same nutrients. And if you're, using your food safety tactics in the kitchen too, you're achieving the same, energy and nutrient-based intake from those foods. Also working in the Baltimore area, depending on socioeconomic status too, I typically don't recommend it, kind of meeting the patient where they're at. I have had patients who love to eat organic as well, so nothing against that as well, but it's not necessarily indicated for treatment and kind of nutrition therapy overall.
Thank you very much. Monica, could you speak a little bit more about considerations before signing up for Medicare Advantage?
Sure. So Medicare Advantage is an option where someone is receiving their hospital and medical benefits through what's called a managed care plan, which means it's a health insurance company that is managing the plan. It also means there's going to be a specific network of doctors and providers. That's different from original Medicare, where someone gets Parts A and B separately. The benefits of getting Parts A and B separately under original Medicare is that it's fee for service. So someone can go to any provider around the country that accepts Medicare and get coverage. And I certainly see that happening for people who are in situations where maybe they have a rarer diagnosis and they want to be able to go see a specialist in a different state, for example. With Medicare Advantage, that might not be possible based on the network of providers. There have also been some studies done that show with Medicare Advantage, there are more hoops that people have to jump through in order to access care. The fancy word for that is utilization management. So that's going to be things like prior authorizations, for example. The other challenge with Medicare Advantage plans is that once someone decides to purchase a Medicare Advantage plan, it is possible for them to switch over back to original Medicare, but they may be limited in their ability to purchase a supplemental plan or a Medigap plan. So two terms for the same thing. And the benefit of the Medigap plan is it helps cover out-of-pocket costs with A and B. So, there is no one-size-fits-all answer to whether someone should have original Medicare or Medicare Advantage. I think The major things to keep in mind are once you pick an Advantage plan, you can be locked in to a more limited network of providers for the rest of your life, depending on circumstances.
Thank you. Very helpful. I'm going to make you go a little longer, Monica. If someone needs help navigating Medicare open enrollment and other Social Security benefits, is there someone specifically on your team to guide, or would you recommend folks call the SHIP office?
So we answer tons of questions around Medicare and Social Security and disability insurance. We also have tons of resources that people can take a look at to learn more and maybe narrow down their questions. So the way that someone would get help is, again, through that legal and financial navigation program where they fill out the intake form on our website and schedule an appointment with us. If someone needs help with the actual application for something related to Medicare, then the SHIP counselors are a wonderful resource. For those that might not be familiar, SHIP programs are the state health insurance assistance programs. They're called different things in different places, but they're non-biased entities who can help people navigate Medicare enrollment, switching from, Advantage back to original Medicare. They can also help with things like appeals and applying for the financial assistance programs that exist in Medicare as well.
Thank you so much. Sam, if I were to sign up for MAPS, would I be matched with someone within the Hopkins network or not?
Phenomenal question. So as we work to build up the community of Hopkins mentors, we may not have the best fit for your needs yet. It's not to say we will not, but we have the benefit of leaning on our network of 500 plus mentors in the meantime until we're able to train, enough mentors from the Hopkins community to adequately support the newly diagnosed patients or caregivers coming to us. So I hope that answers the question. So we, depending on, the diagnosis, treatment types you're looking for, the best mentor fit may not be someone from Hopkins quite yet, but that is the ultimate goal, is to have a, broad, diverse group of MAPS mentors that can support the requests coming in.
Wonderful. Thank you. And jumping back to nutrition, Lizzie, how about plant-based diets? What is your view on that? Do cancer patients get enough protein with plant-based diets?
Yeah, I've actually worked with a few different patients that'll follow, a vegan or vegetarian diet for cultural or religious purposes. And it does take a little bit of effort, choosing quinoa, rice and beans, even tofu, soy-based products. But it definitely is doable. Not necessarily that you have to follow that diet, but if you're already following it, maybe even for ethical reasons, there's ways to work around it. There's also really great plant-based oral nutrition shakes on the market too, and more keep coming out as well, that are pea protein based, and a lot of patients tolerate them well during treatment, or even after treatment too. So it's definitely doable. I think that probably answers the question. Yeah.
Thank you. And do you offer virtual cooking classes for cancer nutrition?
That would be awesome. I personally do not, but I would love to get in my kitchen and cook with you all. So maybe stay tuned on the horizon. We could organize it. It sounds great.
Thank you. And feel free to keep the questions coming. We have a few more minutes before we'll wrap up. Another question we have, Monica, if a patient is planning to travel outside of the country, is there any specific planning insurance-wise that they should make?
Well, I would say the first step is to check existing insurance to see what type of coverage they might already have. So some insurance policies do cover out of state or out of country care. There are some travel insurance policies that someone could purchase, but it is important to read the fine print in those because they may not cover things related to pre-existing conditions. We do actually have a blog on traveling during cancer treatment that outlines some practical steps that someone could take. I would also say not insurance related, but something to take into consideration is making sure all of your planning documents are in place. So I mean things like your advanced healthcare directive and power of attorneys, both for healthcare and financial affairs, so that in the event of something happening, everything is in place.
Wonderful. And piggybacking on that, Triage Cancer is a remarkable resource, as we're hearing. What other legal areas do you specialize in? Anything else that this audience should know about?
Well, first of all, thank you very much. I appreciate that. The primary legal issues that we typically talk to people about are certainly around understanding health insurance, and that means how to pick your plans, but also then how to effectively use your plan once you have it. We talk considerably around employment issues, working through treatment, returning to work, taking time off, how to replace that lost income if someone does have to stop working for either a short or long period of time. Estate planning and finances, I would say, are sort of the core things that we talk to people about most often.
Great. I'll fire one more at you right now. When picking a marketplace plan, is there a level that you would generally most recommend for a young adult cancer patient?
Again, this is not a one size fits all answer. I would say it kind of depends on what's available to someone. Like there are some places in the country where there aren't platinum plans being sold. So gold is your best option. I do think it's most important for everybody to be doing that math and then also checking the providers, because sometimes people will do the math and then they'll pick the cheapest plan and find out, oh, my doctor's not covered, or 2 of my 5 are covered. And so it does take some legwork. I recommend actually calling the provider in question and asking, do you take, and please don't say marketplace plans, please don't say Obamacare, please don't just say Blue Cross Blue Shield or whatever the company is, but literally use the exact name of the plan. Do you take Humana Gold 6000 PPO? Because that's the only way that that provider is going to know whether or not they're in that plan's network.
Great. Thank you. Sam, when peers connect, caregivers or patients, is it all virtual or are there in-person opportunities for connecting?
Yeah, great question. We are majority of the interactions between mentor and mentee are virtual, but in partnerships and collaborations such as the MAPS program, where we are building a community within a certain institution or regional area, there may be opportunities if both the mentor and mentee feel like that's something they would be comfortable with. Our program is so centered on the individual's needs and the type of support that they're looking for. So we really allow the mentor mentee to kind of make those decisions together. If that's something they're comfortable with, if that's something that the mentee would feel supported by, we encourage it and we'll support it. And something about our program is unique in the fact that our team follows up with the mentors after each interaction. So every time a mentor connects with their mentee, they're letting us know. It allows us to support the mentor, through that relationship. If they have questions, if there's different scenarios that we can support the mentor with, while also ensuring the mentee's needs are being met. So we stay very connected throughout the length of the match relationship to ensure that everyone is, feeling supported in all of the ways they need to be.
Wonderful. Thank you. All right, I think we are wrapping up. We have one more question for Lizzie. In post-treatment, what is the recommended, this might be a person, like a very customized question, but the recommended fluid intake, is there kind of an umbrella rule for that, or is that very sort of customized?
Yeah, a registered dietitian can actually calculate your personalized fluid intake needs. We have various equations that we have, especially at Johns Hopkins with our standards of care. So I think they said like 64 ounces, which is great. That's around like 2 liters per day. That's kind of like the baseline, I would say. It kind of depends on like the height and the frame of an individual too. It might be a little bit higher, upwards of 3 liters. It also kind of depends on any side effects you're having. If you're having GI issues and you're losing a lot of fluid, those needs might be a little bit higher. I also will say, like, if you're having difficulty getting fluids in, maybe like 8 to 10 cups a day to start, but it is kind of variable. It is individualized too. But that's a really great question. Yeah.
Thank you so much. We'll give a 1-minute pause for any final questions coming in. We really thank you for your attendance today and for our speakers' time and expertise. Thank you so much. I think that will wrap it up. No more questions coming in. So thank you. If you do think of any additional questions, feel free to just respond to the email that I sent out the Zoom link for today. I'm happy to triage those along to our speakers. Additionally, if you would like to become a member of our Living with Cancer newsletter list, feel free to ask to shoot me your name and email as well. I can add you to that list. We send out a monthly resource sheet of many different resources, support services, support groups, financial resources of the like monthly. And we want to thank our speakers for their generous gift of time. I think we have a slide that shares our open enrollment dates that Monica very saliently touched upon already. For Medicare, until December 7th, open enrollment is live. And for Maryland Health Connection from November 1st to January 15th. And we are here as Patient and Family Services to support you in that process. As was very well highlighted, it can be a complex, confusing process, and we are here. That will conclude for today. Have a wonderful day. Thank you again. And if you have, again, any questions, feel free to reach out. Thank you so much.